DrugCheck SalivaScan roadside procedure. One of the important roles of law enforcement officers is identifying impaired driving. While the level of training and experience varies among officers, all are responsible for conducting thorough and complete investigations to establish whether certain drivers are impaired and unable to lawfully operate a vehicle. While an officer's training and experience may vary between standard field sobriety tests, SFST, drug abuse recognition, DAR, advanced roadside impaired driving enforcement, A-RIDE, or a certified drug recognition expert, DRE, they will all generally conduct a similar battery of tests to help evaluate a driver's level of impairment. Although several factors may cause a person to be impaired and unable to drive, the most common cause is alcohol. If alcohol is suspected, a commonly used tool to assist with the officer's investigation is a preliminary breath test, PBT. The PBT can help to validate an officer's observations and establish a preliminary blood alcohol concentration. However, what if the field sobriety tests indicate the driver is impaired and the PBT does not indicate alcohol is the primary source of their impairment? If the officer suspects some other drug or combination of drugs may be the cause of impairment, what can they do? The DrugCheck SalivaScan is a forensic use-only, oral fluid presumptive screening tool that can be used by law enforcement officers to test for up to 10 different drugs in a matter of minutes. Officers will need to follow these simple steps. 1. Store the unopened SalivaScan tests in a climate-controlled environment. 2. Once ready to use, remove the SalivaScan and mouth swab from the foil pouch. 3. Have the driver place the swab inside their mouth and rub the swab on their cheeks, gums, and tongue several times. 4. Have them hold the swab in their closed mouth until color on the saturation indicator strip appears in the window. Note, if at 7 minutes color on the saturation indicator has not appeared, proceed with step 5. 5. Remove the collection swab from the driver's mouth and insert it into the screening device, pushing down until the locking flange locks in place. 6. Ensure that the specimen is contacting all test strips. If not, rotate the device side to side to disperse the specimen within the test chamber. 7. Set the device on a flat surface. 8. Read negative results as soon as 2 lines appear on any test strip, often within 2 minutes. Individual drug strips are color-coded and the drugs are identified with 3-letter abbreviations. 9. Any indication of a colored line in the test, T region, should be considered a line and therefore a negative result. 10. Read presumptive positive results at 10 minutes. Note, the THC, marijuana test strip has increased sensitivity, which may show a less intense colored line and take longer to appear. This is an expected and normal response. The DrugCheck SalivaScan is a presumptive screening test and is not intended to replace an agency's approved evidentiary testing. Oral fluid testing screens for recent drug use and detection times are similar to blood testing, 30 minutes to 24 hours. SalivaScan is made in the USA and can be customized to test for up to 10 of 17 different available drugs. For more information, please visit drugcheck.com.